And welcome back to You Heard It Here with Dr. Gary. Today, we're going to take a look at some problematic middle ears. Our first candidate is sporting a beautiful blue pressure equalization tube. Yep, that straw through the eardrum, that is a pressure equalization tube. In this patient's case, it's been in there for many years. While you watch me remove the wax, let's talk about what a pressure equalization tube actually does. A pressure equalization, or PE tube, is designed to work in concert with a eustachian tube in order to keep the middle ear space equal in pressure to the outer ear space. The PE tube basically gives another outlet for both air and moisture from the middle ear to escape. Our second problematic ear is definitely brought to us by Q-Tippers Anonymous. As you can see, the earwax is indented with the end of a Q-tip, but if you look along the bottom side, you see some redness. So the question is that redness an irritation from the patient digging, or is it an underlying outer ear infection? Let's get the wax out of the way so we can make a determination if we need to send this patient to their primary care doctor once their ears are cleaned. We're going to start by removing the wax from the left-hand side of the ear canal and see if we can't get all the way back and get everything to pop out in one big chunk. Clearly, we were not able to do that. Again, there's that indentation of the Q-tip, so let's go to the right-hand side and see if we can't pull more of this wax away from the wall. Now, it's very possible that we're going to have to use irrigation. In fact, given how much this wax is stuck to the sides, I'm definitely going to be using irrigation, especially once we get enough off the walls that the irrigation will cause this wax to come out towards the aperture of the ear. Okay, and now it's time to irrigate the ears. Look at that beautiful waterfall. It definitely did not look like that in the office, but here's what came out of the patient's ears anyway. And as you can see, that ear canal is still very red, but that wax has come out to the aperture and should be a very easy removal at this point. We're going to scoop this out here. And then as we look back, we see some more along the right-hand side wall. We're going to get that cleaned so we can take a better look at the ear canal and eardrum and see if the patient can valsalva, hold their nose and increase the pressure, opening the eustachian tube and making the eardrum move. As you can see, lots of redness. This patient is definitely being referred to their primary care doctor. Let's see if they can valsalva. And there the eardrum moved. Thank you for watching You Heard It Here with Dr. Gary. Please like and subscribe and stay tuned for more ear-related videos.